This video will demonstrate how to perform vision therapy sessions and assign vision therapy homework in the new Vision VT software. Begin by logging into your account. After logging in, you will see the account dashboard screen. Click on the patient's name in the list of sessions. This brings you directly to the patient session screen. A session has already been programmed, which is shown in our video demonstrating how to program a vision therapy session. Click on the Start button to begin the session. This brings you to the session recording screen with the techniques listed on the left. Record the patient's responses during the technique. Some questions have conditional questions. For example, if you select lenses used, a drop-down question will appear for you to record the lens power. If you do not see questions that you need, you can customize your software. This demonstration is available in a customization video. The observations can be recorded in the space provided. Click Save. Click on the next technique that you would like to have your patient perform. A reminder to save your recording for the current technique will appear. Notice on the top of the screen your approach and delivery method appear and can be changed during the session. The questions are generated by the technique and the approach of the technique. Changing the approach will present a new set of questions for the technique. Notes and observation boxes to the right of the screen are also available to record information during the entire session, as these boxes will remain shown as you progress through each technique. To assign a technique for homework, click on the green plus Add to Homework button. You can add notes to the homework to remind your patients of directions for the technique. A selection of the date and if the technique was completed is also provided. Click Submit to save the homework assignment. Once you have completed the technique, click the Finish button to save the recordings in a read-only format. This allows you to view the recorded results, but changes cannot be made. The read-only format is indicated by the red circle next to the technique name. If you have programmed a technique and would like to remove it from the session, click the appropriate technique and click the Remove button. You can also find techniques to add during a session by clicking the Find button. In the programming window, find a technique to add to the session. If you don't see a technique that you need, you can customize your list. This demonstration is available in a customization video. You can also make a copy of a technique during the session, which is helpful if you are repeating the technique with a new approach or delivery method. Click the Return button to go back to the patient session screen. If the session has not yet been completed, a resume title will appear for that session. This allows for the therapist to return to the session and make changes, or for the doctor to review any information before finalizing the session, including adding observations and notes. Click the Finish button to save changes for the technique. Now that all the techniques have been finished, the vision therapy session can be finalized. To finalize the session, click the Complete button, which changes the resume status to a read-only format. This will be shown by the View button on the vision therapy session line. You can still add notes to the session after it has been finalized. This is helpful in making notes for programming the next vision therapy session, including techniques not completed during the current session. The time and date will be added to the notes. Click Submit to save. The new Vision VT software allows you to print the results of vision therapy sessions. Select the session and click the Print button to generate the vision therapy session report. This session will be opened in a PDF format, which includes your office information, including your office logo. The session information, including date and session number, as well as patient diagnosis, are included. Here you can see the results of the techniques completed during the vision therapy session. You can print the report or save as a PDF document. When returning to the patient session screen, you can click on the Patient Homework tab to view and add assigned homework techniques. Here you can see the technique that was added during the vision therapy session. You can make notes for the patient and add patient instructions. Once you have finished adding homework notes, click the Save button. To print the assigned homework, click the Print button to generate the homework report. Like the Vision Therapy Session Report, the homework report can be printed or saved as a PDF document. The homework report also includes your office information and the homework notes and technique notes. You can also scan and save your office technique instruction sheets in the Documents tab to print for your patients. Using the programming window, you can find additional techniques to add to the homework assignment. This concludes the demonstration of how to perform vision therapy sessions and assign vision therapy homework in New Vision VT software.